So thank you everyone for joining today. As Lauren said, we are going to talk about transforming healthcare through community. And I'm really going to take you guys through the full funnel strategy we have here at PRM. I actually spent about 10 years in B2B tech before this. So my journey into healthcare marketing was definitely an unusual one. When I joined into healthcare marketing and specifically into PRM, I brought a lot of those B2B marketing concepts with me. And I really have brought that with me through how I've built our marketing concepts, through how I've built our patient journey. But in addition to that, the reason that I joined PRM specifically is because I am a patient. Not necessarily was I a patient of PRM when I joined, although I am now, but I was an endometriosis patient. And so pelvic rehabilitation medicine or PRM is basically what we do is I say we're a women's health company, but we do see about 80-20 split of men and women, and we're a national healthcare organization. We have 14 locations in 10 states, and we treat the pelvic floor. So anything from the belly button to the mid-thigh is what we say. Truly what happens is if you have any pain in that pelvic area, we can treat it. But what's unique about us is that we have a patented PRM protocol, which treats patients non-operatively. Traditionally, patients in this space are only offered things that are a Band-Aid. They, have minimal sustained relief, and they're often misdiagnosed. A lot of our patients come to us after 7 to 12 years of misdiagnosis. They've seen 10 to 15 providers, and they don't even know what's wrong with them, and they're just doing all these tests and procedures. And so our founders, Dr. Allison Triconde and Dr. Gautam Triconde, created our protocol to help those patients. But then in addition to that, since our primary patient has endometriosis, we have world-class surgeons that we can essentially offer them prehab, surgery, and post-hab. So I want to talk a little bit about that today, and how we've sort of transformed our healthcare space through building a true patient journey, understanding our personas, and also building a community for them. So today we'll talk about our journey, how you can understand your journey, our process, how you can build your own process, finding out who your patients truly are, because what we have found is that they're not just endo patients or pelvic pain patients. They actually are, more than that. There's different levels of a patient. Where are they, and how can you build your own community? And I'll talk to you about how we built ours. I know I talked a little bit about my story, but one of the things I always like to remind people when talking about our patients, and it's something to think about with your own patients, is the female healthcare consumer wants so much control over their health choices and decisions, which makes sense when you consider how underfunded women's healthcare is. And that's something that we talk about a lot. Endometriosis, for example, just gets a tiny fraction of healthcare funding. And so there's so many possible decisions that can be made. I mean, women in general weren't studied in terms of medical research until 1993. So these women are used to being silenced, dismissed, and unfortunately told it's all in your head. Me personally, I started experiencing symptoms of endometriosis when I was 15, and my mom has endometriosis. So I was asking about it that young and kept being told that nothing was wrong with me, and it was in my head, and try birth control. So this puts the healthcare industry at a whole at a tipping point, because the tactics we used before don't necessarily work, because we need to meet the patients where they are. They're on the internet. They're finding their symptoms on Google, and they're looking on Instagram, and they're looking on Reddit. So we settle for nothing less at PRM than provider-led research-backed content, easily digestible FAQs, and authentic and human-led communication, and honestly building community consistency and FAQs, because we know that's what our patients are looking for. So this is our process in general for everything we do, whether it's paid, whether it's events, whether it's just traditional digital marketing, social media. We research the entire patient population, and that could be different, right? What's happening in California is not the same as what's happening in Michigan. So based on location, we develop content and campaigns to target them, and then we build brand awareness nationally and regionally. I always remind folks that the PRM brand nationally should be the same, but then we have to like zoom in on the actual location and what matters to them. In New York City, we have high competition for surgery because there's so many surgeons. We don't experience that in, somewhere like Michigan. We have to understand their search, diagnosis, and behavior, educate and validate them, and then building retention and advocacy. That's something that when I first joined PRM, I reminded everyone that meeting the patients where they are means that building that retention and advocacy meant community. So I want to kind of say to everyone right now, do you, in terms of process, do you understand your patient personas? And I'm going to pop that up as a quiz because I think that I want to understand from everyone, like, have you gone through this process and do you know who they are? And I also want to remind everyone while we're filling out this quiz or this, survey question, and I'll share the answers once we've all filled it out. There's a Q&A box. So at the end of my session, I will go to all those Q&As as well. So, any questions you have as we're chatting, feel free to drop them in. And patient personas could mean that you understand, the patient types and who they are. And I even say in here, like, they might not be documented and that's okay. Maybe you only have one, that's fine too. We're going to go through that in the process we've kind of gone through at PRM to understand, who the rest of them are. And I think, that's everyone's probably voted at this point. So let's see the results. Wow, a good amount of you, half of you have your patient personas documented, which is great. And there's a few of you that say you're working on it now. And some of you are, you're not sure. You think you only have one. Some of you say no. So this is going to be exciting for us to kind of go through what we've done at PRM. Because what I found, even when I first started here 2 years ago, was we thought we understood our patient personas. We thought we had pelvic pain patients, endo patients, men and women. We thought it was pretty simple. And even I thought it was pretty simple as an endo patient, right? Like, I thought I knew it. I was like, this makes sense. I'm an endo patient. I'd had endometriosis excision surgery already before joining PRM. I was like, I get who these patients are. And guess what? I didn't. So, this is beyond what their healthcare needs are. You want to understand how they're searching. You want to understand the urgency beyond their needs. And that was something I don't think I'd considered when we first started going down this journey, that like urgency usually equates to how fast they're willing to make an appointment, keep the appointment, spend the money on the appointment. How much do they understand about their needs? We see a lot of patients who come in with like a smorgasbord of symptoms and they don't really know what's wrong with them. And that can confuse them when it comes to what type of treatments they need. And for us, especially, that's a little bit confusing because we're offering a patented PRM protocol, which is the first of its kind in the nation. And it's non-operative treatment through a series of injections into the pelvic floor and nerves. So they're trying to understand that when everyone else has told them that there's no help for them, in addition to the fact that they might not even understand what they need. How much do they know about how you can help? So that kind of leads into that. What price tag are they willing to put on it? If you're in network, out of network, self-pay, we offer all those varieties. Those are all different patient personas. And then who are they seeking advice from? Which again leads us into community. Our patients are seeking advice from Reddit, from Instagram, from all areas. Some of it is accurate, some of it is not. And that's a challenge for us. So this is why I built this Candyland map. So you can see here that, similar to all of your, by your journey marketing mix, your patient journey, yours all probably looks similar, right? You've got patient awareness, you've got, they've not started and they're reimagining their health journey, you're building marketing campaigns, you're probably using all of these channels. It's probably not too dissimilar. But I think what we discovered when I started here is that, one, there's a MOPS alignment, which is marketing and operations. I actually made t-shirts and brought them in to HQ this week for our board meeting. Really strong there. So, what I found is that starting at the beginning, when they're becoming aware, for our patients anyway, they're using social media. Obviously, they're reading Google reviews, everyone is, but they're really becoming aware on Instagram for our patients. And then they're searching, we rely heavily on content marketing and paid like everyone else, But guess what? Once we launched our community, we found that that was another place where they were finding us, because they were finding us on Reddit and Instagram already. So why shouldn't they find us on our community? Next thing, they move over here and the marketing operations alignment comes, and there's our community again. Why? Because every new patient at PRM joins the community so they can talk to each other about questions they have. So then they become they're admitting, they're converting, maybe they're getting surgery, they're doing post-tab, we're emailing them, we're retaining them through email marketing. But then what happens again? Well, Worthy Warrior is there again. And I realize that's the first time I said the name. That's the name of our community forum. And, that's another place where we're building advocacy, we're building retention, and hopefully bringing in more patients. So the way I look at a community is like, it can be a place to build new patients, but also a place to build a community, build retention. And, we don't have just PRM patients in there. We have all pelvic pain patients. So this journey sort of like evolved over time for us as we started to build this community. So for us, it all started with like understanding our patients. I started to mention some of these stats. They're ingrained in my brain. But for me, one of the things that I really drove home to leadership when I thought about this community is 1 in 4 people have self-diagnosed based on social media information in healthcare in general, not just in pelvic pain. 43% of those who self-diagnosed followed up with a medical professional. So that's great. They know that, hey, I can't just self-diagnose on Instagram. But the crazy part for me was 82% who visited a doctor after self-diagnosing on social were right. So that tells you that the information on social media and the value of community, and I use social media broadly because social media also includes Reddit and YouTube. It's right? It's accurate. Patients are valuing it. And we knew as marketers, like all of us know, that, social media and like the value of like social, the social value people put on things is important. If 6 people on the internet tell you to do something, you're probably going to listen to it. That's why influencer marketing is such a big deal. And that's why people pay all that money for influencers. But I think with the healthcare community, it's less about influencers and more about like experiences and like how many people can talk to you about their experiences with a provider or with a healthcare situation. Or like in our case, like you saw 7 providers before you found us and experienced 12 years of misdiagnosis. So if you had countless unnecessary procedures, medications, and workups, and your experience with our treatment and our providers, you're sharing that now and you're saying, hey, I saw 7 providers and these people really listened to me. They validated me. And guess what? I am feeling pain-free for the first time ever after their treatment. That is more valuable than anything else. So I thought, how can we harness that somewhere? Because the real issue is that at the end of the day, when it goes on Instagram, and this was my experience anyway, getting, diagnosing myself on the internet, was everything's on Instagram and on Reddit, and it's not in one place where you can find it. But when you join these community forums, you have places to see it all, and you can save it, and you can meet people. One of the things that I found as an endo patient was the first time I went to the endometriosis summit, I made a lot of friends there. And I remember coming home to my husband and saying, it was a little emotional for me. And he said, what do you mean? And I said, well, I was in a room with people just like me. When I was eating and taking my vitamins, or I was struggling to decide what meal to eat based on how much inflammation it would cause, or when I was tired and my legs were swelling, and I had to put my feet up, everyone was the same. And I said, I wish I could harness that somewhere so that like virtually we could build that for our patients. And that is kind of where Worthy Warrior started to really pick up ground. As I said, our patients need friends. They need the endo community, the pelvic pain community. They need a place where they can talk about their experiences and talk about their healthcare experiences. So that's where we started building our personas. I like to say we want to ensure motivated explorers seek our help. But for us, like, that's just like, I put a little screen grab here of all of our personas, but it kind of goes into like a back and forth. And really it's to operationalize the personas. We need to identify how our patients fit into what. And that's something we're really working on right now at PRM, is like building it into our intake process. building it into the process in our actual offices. And that's where that MOPS alignment comes from again. It's hard. We figured out these 5 screening questions that the intake team, which is our call center team, will ask our patients. But we also worked with our director of operations to build them into our structured data in ECW. So we ask our patients these 5 questions, and these 5 questions then determine where they fall on the scale. Are they a long-time sufferer? Are they a high pain skeptic? Are they an urgent newbie? And why this matters is because each one of those personas then has kind of like a description about them, and then what do we know about them? And we figured this out by interviewing patients, reviewing data on how our patients convert through the funnel. So we basically looked at, over the last year and a half, all of our marketing data, and then all of our data from B2B, and reviewed their patient journey. So, how did they come in? What were they saying about their health in our appointment forms? And obviously we, anonymized it. And then what was their journey? Did they come in for a new patient visit and, admit 6 months later? Or did they come in for a new patient visit and immediately admit? If they were self-pay, were they willing to pay? And what we found is that depending on the patient's pain level, how many years they've been in pain, how long they've been in pain, it determined whether or not they'd be willing to do our protocol right away, and then if they were willing to pay out of pocket. And why that was important to us is because while we're in with Blue Cross Blue Shield, we do offer self-pay to all of our patients because we are out of network carriers with all of the other insurances. And so for us, that's important because we need to understand how our patients are looking at the value of our services. And we want to understand that for another reason, and it's because it changes how the provider talks to the patient. It changes how our call center talks to the patient. So then that builds the question of, when do we start talking about this? How do we define the persona? So, those are the questions we determined, but how can our call center or intake team use that? So the screenshot over there is the intake team putting it in the structured data, but I thought we need to ask it at the appointment level. So when the appointment request comes in now, we are going to build those questions into the thank you page. So in my mind's perfect vision, the call center then can just validate that. They see it come in through Salesforce. They know what type of persona the patient is, and it changes their scripting. It changes how they talk to the patient. It changes how they educate the patient. If you're thinking about defining your personas that way, I feel like defining the questions that they should answer yes to be a good candidate for treatment is the first way to start. That was actually the first thing we ever did. We talked to Dr. Alley and we said, what are the questions that a patient needs to ask to be a candidate? So we have 5 questions about their pain and where they feel their pain. If they answer yes to any of the 5 questions, we know the protocol can help. Then we think about what's the immediacy and how much more education might they need and time based on how immediate their desire is. Something that just this week when I got to HQ, my director of operations brought up to me is she said, the immediacy might be different depending on the payer type. That's a sub-persona right there. So personalized communication based on the type of payer is going to be a whole nother persona that we haven't even thought about yet. So it might change depending on, what your healthcare organization is doing and how you're treating patients. If you're all self-pay, then obviously that won't change things. But if you're a national organization and you offer health insurance, you take health insurance, but the insurance rates are different in all different places, that might change things. If you're accepting Medicare or Medicaid, that's going to change things. I mean, in all of our offices, because no office is the same, that's changing how we look at things. So we've created a bunch of quizzes, taken, interviews, and just really urged our team to ask the questions. Then, of course, I, want to dive into how we got to that community, which leads to kind of my next survey question. And I want to kind of understand a little bit, do you understand how your patients are consuming that information about their conditions and their diagnosis, and how is that helping you to build the personas? And that's kind of where I want to get to a little bit here. So that's our next kind of survey poll here, if we can pull it up. And maybe we can't, and that's okay. We'll keep rolling. But kind of why I'm asking that question is I wanted to understand from everyone, like, oh, there we go. Let's take it really quickly. So where do your patients consume condition and diagnosis information? Is it social? Is it office reviews? Is it Google? And the reason why I'm asking is because I think that really helps you understand, one, their persona, and two, where their community is. Like, where are they consuming the information? I'll give it like a minute here. All right, I think we're good. Let's see the results. So a lot of you are saying Google, and I think like Google is absolutely, I would say 50% of our web traffic. It's funny that so few of you think it's Google reviews and your office, and then a lot of you are unsure. And then social media being like 20% of you. So for us, I would say, you know, it's probably 50-50 with Google and social media, and social media being the broad social media term here, YouTube, Reddit. And for us, our social media is, it's not typical for healthcare. If you check out our social media, it's very, like some of these pictures, like very validating, very education focused. It's focused on the questions our patients are asking. We do feature our providers at least once a week, but even when we do that, it's focused on the questions that our patients are asking. And those questions are not always about the PRN protocol. They're like, endometriosis and leg pain, what's up with that? Like, we try to really do it as a resource and community, which really led naturally into the content marketing we were building. So, I mean, we're featuring them at events. We're doing Instagram lives, collaborating with other folks in our community. We're getting them featured in the press because we want our providers to be the experts, and we want to make sure our patients know that this is an expert, area for them to look to. It's not going to be misinformation that they might get from like a Reddit forum. And then, we take all of that and we make sure that it all gets built into a SEO strategy and a PPC strategy. We use PMAX, we use national and local campaigns, we drive them into PPC, and make sure they seek our help. And we drive them using PPC to Worthy Warrior. Why? Because sometimes folks aren't ready to schedule a doctor's appointment. So why not drive them to the forum and the forum social media accounts where we know they could ask more questions. I always say, meet the patients where they are. So the quickest way, I think, how you can find them is to become a patient, but not everybody is going to go ahead and have the PRN protocol and have surgery. These are actually photos of me having the PRN protocol a couple months ago. This is us at the Endo Summit, us launching Worthy Warrior. And I say us, it's my marketing team. Here's a couple of our providers. But search like the patient on Google. What questions are they asking? Attend patient events, ask your patients. We interview our patients frequently and ask them questions. I personally still manage our social media in some capacity. I answer all their DMs. I chat with them. Some of our marketing team members interview them regularly. Which is why when we built Worthy Warrior, the first thing we did when we did the website design and the forum design with Cardinal is we did an event preview. So we launched it at the Endo Summit, and we weren't like bullish about it. We, stuck stickers on the walls. We had a beta launch where we've invited early users to join the forum and give us their feedback. We built a social media community. We have a special PRN patient audience where they're getting certain resources, and we're doing email nurtures as well. So we're emailing our patients regularly and the Worthy Warrior people regularly about what's going on in the forum. Our goals are quite simple. We want to end the silence. We want to make sure that all the warriors out there have a place to see themselves, to be validated. The photos on the site are primarily real patients. This little thing here is a lot of me and some other patients. The content on the site is very much like, you're a warrior, here's why you're here. The back end of the forum mimics a lot of data on like user access. And we measure success because we want to see how the forum's doing in a different way though. We look at patient acquisition, how many new patients scheduled are becoming NPVs, how many patients are becoming admits. But at the executive leadership level, we're really looking at like worthy warrior active users. How many PRM patients are active users? How are they engaging with our content? And like, here's the back end of our forum, which shows us the health. This spike here was the day we launched. So we were so excited to see how many people joined immediately. And now we have all these patients going in there and asking questions that drives more information back to us at PRM about how our patients are thinking. And then back into the forum, we let our doctors respond to questions. We respond directly to them. And then we, build more engagement on social. And we've essentially tried to create our own Reddit. We don't hide that PRM created the forum. It's Worthy Warrior, created by Pelvic Rehabilitation Medicine or powered by Pelvic Rehabilitation Medicine. It's a place for our patients to have a community. How can your practice build community? Obviously, not everyone's going to be able to build a forum or find it necessary. So again, I say, interview your patients, happy, unhappy, do it in the office. Like, honestly, like have your doctors just ask them questions, read the Reddit forums about the conditions you treat, host events at your office. We've done that a ton, just happy hours. Go to local events, go through your patient experience. Maybe you're not going to become a patient, but go through it as if you are a patient. I don't think everyone is going to have the experience I did where you have a surgery and go through the PRM protocol. I literally am 4 weeks recovered this week. Shadow a patient though, like just literally shadow them. And I think that's a community building in itself. Just, learning and understanding them and maybe getting them to talk to each other even. So that's kind of the end of my slides, but I want to jump into the Q&A a little bit because I saw some questions coming in the chat and some coming in. So let's see. First one, how long does the process from screening to finalizing the personas for your business take? This is a great question. So the whole process for that took us about 90 days. Just doing the interviews and creating the personas. And I will be transparent and say that we're still kind of working on building that out into the business now. We know the personas, we have the questions into the intake process, but we are still working on getting the data because I think it's going to take us realistically, Ashley and I, our director of operations, feel it's going to take us about 90 days to see the true impact of the data. Like we have the personas built, but now what's the data going to tell us once we have it in practice? So I think you should, take the time to build the personas, but then let the data tell you how accurate and how useful they are. Let's see. I saw some in the chat too. So let me pull up that chat. How are you able to determine which social channels work best for PRM? I'm going to be honest with you. I had a gut feeling as a patient myself that it was going to be Instagram, but we have Sprout Social as a tool and we post on every channel, but Sprout Social allows us to track all of that data, not just the vanity metrics that, Meta gives you, but like tracks the engagement, tracks all of that. And so we started tracking it that way and weeding out how frequently we were posting on the channels that weren't working. I've tried to interview patients but haven't received a what are you doing that got them to say yes. Funny enough, we were having similar issues and Britannia on my team decided to start going through our Google reviews and finding the best Google reviews that were like the longest and most detailed and emailing them directly and saying, I found your review to be very passionate. Would you be willing to be interviewed? And they always say yes in that case. So I think look for the passion somewhere else. And those are probably the patients that you'll get. That's kind of been our best bet. Sometimes we even try to find them on Reddit, but that's harder. Personalized, they know it. That's a great comment, Erin. Just checking to see if there's any more questions here. I know we're like at the time. But HIPAA issue. We're emailing them. No, it's not a HIPAA issue because if they're on Google, we're emailing them through Google. And then if they say yes, we're asking, is it okay if we contact you? Do you have information? And that's a great question because a lot of times patients will do the same on Instagram and I contact them that way. Like they'll post like an entire video of them getting treated through PRM with their faces and everything. And I will DM them and say, thank you for sharing this. This is incredible. 1, do you mind if I reshare it? And 2, do you mind if I contact you about getting more information about this? So basically, as long as you ask them, it's okay. And once they share that information on social media, it's like, okay, now they've shared it. So it's not, we didn't do anything. It's just that you need to get the ask. And we do have to wrap up for the next session, but please feel free to email me or message me in the lobby if you want to chat more. I love talking about this, as Lauren said, and thank you all for joining.